Hi, friends, and a good afternoon to each and every one of you. Today, we are presenting a very interesting case, as we have mentioned already to each and every one of you. This is a case where we have a patient who had come to us, and she's a young lady. Okay, her age is 32 years old, and unfortunately, the lady had developed cancer, locally advanced cancer of the rectum when she was very young without any strong family history. Okay, so this is around 4 years back. This is just actually at the time of COVID. And at that point in time, we had done an ovarian transposition for her. Now, ovarian transposition basically is a procedure where you are going to ensure that you mobilize the entire IP ligament, entire infundibulopelvic ligament, and try to transpose the ovaries as high as possible. So the best site to do the ovarian transposition and the best method to do it is obviously a laparoscopic surgery. And the laparoscopic surgery was done to transpose the ovarian on both the side, on the ascending and the descending colon, close to the hepatic flexure and the splenic flexure. So that is a very good thing, right? This was predominantly done because the lady was requiring to do something called as local radiation, and this local radiation was required because she had a locally advanced cancer. Now, whenever you have a local radiation which is required to any lady in this situation, you should remember one thing: the radiation does not know that the ovary is there, right? The radiation also does not know that the uterus is there. So what is going to happen in this situation is that once you give the radiation to that field, to the pelvis, of course it will help you in the colon cancer, but it is not going to give you any benefit as far as fertility is concerned. In fact, it is detrimental for fertility. And when you have something which is detrimental for fertility, it is going to affect the uterus as well as it is going to affect the ovaries. I want to tell you one thing: even if you do ovarian transposition, the probability that her ovarian reserve will go down is very high, because there is some amount of spread of radiation. Even if you give targeted pelvic radiation, there can be a spread. There can be a spread which goes and affects the vessels, which can ultimately reduce the AMH. Of course, after that, she underwent a surgery. It was a surgery with a temporary ileostomy, following which the ileostomy was reversed, and following which she had to take chemotherapy. Now, remember one thing: the type of chemotherapy which is given in these type of malignancies, again, detrimental. However, in the interval at the time of doing ovarian transposition, she and her husband, till the time they started chemotherapy, both of them were very particular. They had come to the hospital. This is around, I think, around 3.5 years back. They had come to the hospital and they preserved their embryos. Now, that is the best thing which they did. They underwent an IVF cycle at that point in time, and they preserved their embryos at a point where her AMH was reasonably normal, which was approximately 1.4 at that point in time. And then, of course, she underwent the rest of the chemo and all these types of things. She did have two follow-ups with us, but of course, we were not going to do anything as far as her case is concerned till we have a clearance from the consultant surgical and medical oncology team. Now, finally, the medical and surgical oncology team gave us the clearance. They told us that, boss, nothing to do. Go ahead. You can put the embryos inside the uterus if you want, because the patient seems to be completely fine. Okay, two important points. When you do an egg pickup for a transposed ovary, you have to do an abdominal pickup. So we normally did like how we do for Mullerian anomalies, we did a laparoscopic egg pickup for her at that point in time. Transvaginal access is simply not possible, right? So we did that. After that, the embryos are frozen in the standard method. But remember one thing: the uterine lining gets severely damaged. So we did a hysteroscopy. We saw that the uterus is okay, sufficiently fine. We prepared her. There is no way in which you can do a natural cycle preparation. So we prepared her with HRT. We had used estradiol hemihydrate. We got the lining to approximately 8.8 centimeters. And after the lining became 8.8 millimeters, we went ahead with the embryo transfer using the basic standard protocol, where we use dufastone and where we use progesterone gel. As you know, we don't use anything else. Fortunately, usually in these types of uteri, the chances of having a pregnancy is going to be around 10% post radiation. Now, this lady not just conceived, she's got cardiac activity, and yesterday because the cardiac activity has come, we had a little celebration in the hospital, and I wanted to convey this through such a live message across all social media platforms, that women with even such complicated things, if they are in the right hands with the right multidisciplinary team, they are able to achieve a good conception. Of course, they need a good amount of luck also. Obviously, guys, remember, at our types of units, all these embryos are put in at day 5. So we always do a day 5 embryo transfer. But a good multidisciplinary approach, a fantastic medical oncologist, a fantastic surgical oncologist, as well as the reproductive team and the team which specializes in laparoscopic surgery, where we do transposition in a manner where, despite local radiation, you are able to preserve the embryos, was done, and she's achieved a pregnancy. At the end, I would like to tell you that ideally we should have also done the testing, the genetic testing of the embryo, if it was a euploid embryo or not. We did not do that around 3.5 years back, but if in case there is a site for improvement, then that is something which we should have considered to do in this young lady. And probably if we would have done that, no, it would have been like even more better. It's like the best and the most ideal treatment. But still, she has conceived, so we are very happy, and we shall be very happy to answer your questions over this live stream. And as I have promised, I'll try to come live much more often on request of all my friends and all my students. I wish you a very happy Sunday. Bye bye, and take care.